So again, without going too deep into a diagnosis or what's going on, I'm going to give you a couple reasons why somebody might have pain going backwards. So this is going to go to a concept related to the pain cycle and has to do with the chronicity of pain. Many times we'll experience pain, and sometimes it's not even fully pain, it's just a lot of stiffness in one direction or another. And this stiffness responds really, really well towards movement in the opposite direction, whether it be flexion or in this case, extension. Other causes of extension pain could be structural. There could be a scoliotic factor. There could be a bony factor where the bones back there are a little bit thicker, and when you lean back they kind of bump into each other and you feel discomfort there. But a lot of it's just going to be simply your body has developed a painful response towards moving in that direction. And this is where our program will be extremely helpful to you.
Sure, absolutely.
So
some common things you may notice if this is you is like if you have pain with standing for a long period of time and it actually relieves when you sit down, or if you have pain reaching overhead, whether that's just to get a jar or whether you're painting for a long period of time. And the reason for that is when you stand, now you have that natural lordotic curve, which is a version of extension. See how that curve gets bigger as I extend backwards? Well, we have that natural curve when we stand up, just like that, okay? And it accentuates, especially when we go arms overhead, right? If we don't have the core control or the mid-back mobility to go overhead without that, it'll probably be a little bit more sensitive, right? Makes sense.
And this is why it's really important to understand that. So what he was describing was he doesn't have the core control. So this is a situation where potential posture can matter. So what I mean by posture is if when you stand up or when you're moving, if you are stuck in extension or anteriorly pelvic tilted in this for long time periods, your body has nowhere to go and it's always tilted back, then you probably are going to be extension intolerant. And you can simply find this out by standing up and trying to arch your back, and you'll find that you have nowhere to go because you're already arched. And then when you pull your hips forward, you have a lot of motion. This is a good indicator that you are kind of stuck in this position, or that you're in this position a lot because this is your normal or your neutral.
Yeah, and these anterior and posterior pelvic tilts, this just little small exercise is actually great to see, is this painful, is this relieving, and vice versa. And that's a little hint into what direction your body prefers in general.
They may have saw all that with a decapitated version of you.
Yeah, it's okay.
Yeah.
I mean, I look better this way anyways.
I was going to disagree. I'm like, if we're keeping one head in frame, it's yours, not mine.
Oh, babe.
So
there's extension intolerance for you. Do you have anything else to add? I think we covered most of it in terms of the education. Again, stay tuned. We're gonna go over micro breaks, and we're probably gonna give 1 or 2 exercises that fits in either preference, so you can have a better idea what the concept means and how to use it.
Yeah.
As well as pain cycle. We're gonna go over a lot of stuff, so stay tuned. Watch our other videos, and like them or share them or all that fun social media stuff.